Hi, welcome to the May 25 Rapid Update in Therapeutic News. In the next 5 minutes, I'll give a brief overview of some new guidance from NICE on gambling and falls and an alert from MHRA. So this guideline on gambling applies to people experiencing or affected by someone close to them who is experiencing gambling that harms. And there's a strong recommendation for us to ask people about gambling, particularly people who might be at increased risk. So people with mental health problems, particularly those with thoughts about self-harm, depression, anxiety, or other mental health problems. Also people using alcohol or substance dependence, especially people using cocaine. Other groups at risk of harm, we know that people with Parkinson's taking medicines that might affect impulse controls, so dopamine agonists, at increased risk, as are people using aripiprazole for psychosis. People with homelessness, financial concerns, and relevant family history also might be at increased risk of gambling-related harm. So really it encourages us to consider asking about gambling as we would about smoking, alcohol, or use of other substances. So the next thing is, what can we do? And the first thing really is to advise people that the support and treatment are available and recovery is possible. We need to ask about suicidal thoughts, and then also discuss with people the possibility of practical self-exclusion techniques that could be used to prevent gambling. Of course, we need to provide information, and the guideline goes into that in detail. I did spot this useful information also on the NHS website. So do have a look at this guideline. There's lots of useful tips and information, and really I think the bottom line for us is to remember to ask about gambling. This alert from the MHRA is on the removal of the indication of relief of post-operative pain for prolonged released opioids. And the concern here is that there's an increased risk of persistent post-operative opioid use, so that's use beyond 90 days post-op. And the evidence for this comes from across the EU, including the UK, which shown that the incidence of persistent opioid use post-operatively ranges from 2 to 44% of patients treated with prolonged released opioids. The alert states that pain following surgery is usually short-lived, so 5 to 7 days, and therefore should only require short-term pain management, and that's best treated with immediate released opioids. So this use of immediate release opioids post-op is supported by a consensus best practice guideline, which was agreed by multiple Royal Colleges in the UK. And the advice is also included in the All Wales Pharmacological Management of Pain guidance. And that includes an alert box stating that do not use post-operative opioids on a repeat prescribing template. So that AWMSG document is a very thorough and detailed document which includes lots of useful information. So this is the All Wales pain guidance, which is useful, and also recently published is the National Prescribing Indicators data from to December 2024. This again includes useful information, including local prescribing graphs. You'll see here the orange line reducing, which is Swansea Bay, looking at gabapentinoids, and then there's a good practice box of how they made that reduction. So lastly, the NICE guidance on falls, and the recommendations here are for people over 65 or younger people with one risk factor. So for example, people with long-term health conditions that impact on their daily life, such as arthritis, dementia, diabetes, Parkinson's, stroke, or learning disability. The recommendations are split into different settings, such as community, care home, or hospital. And in the community, it reminds us to ask about the details of falls. So either opportunistically or at annual review. And I found that medication reviews are a good opportunity. The time frame for asking about falls falls in the last year. And there's a strong recommendation to offer people a comprehensive geriatric assessment if they have frailty, They have fall needing medical attention, loss of consciousness, difficulty getting up, and 2 or more falls in the last year. The guideline encourages structured medication review to identify medicines that might increase the risk of falling, and particularly psychotropic medicines. A lot of people can be reluctant. I find people can be reluctant to consider reductions in these medicines, but it's so much easier when you explain that there is an increased risk of falls. And we've got this clear recommendation now that we can share with patients. There's a lot of useful detail in all these documents, so do have a look, and thank you for listening.